Hi friends, I'm Scott Giles and welcome to Power Talk, my podcast here on Facebook Live and YouTube. I cover topics related to hypno-coaching, spirituality, and the hypnotic arts and sciences generally. If you want to know more about my professional work, check out my website, which I'll tag at the end of this video. Today I want to talk about something I hope none of you ever have to deal with: living with chronic pain. However, reality being what it is, some of you have or will have to deal with this, either for yourself or for those of you who are consulting hypnotists with clients. The International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. The thing to notice about this definition is that pain can be sensory distress. That is, we can obviously see there's a physical injury that gives rise to the pain. But it can also be an emotional experience where no outward physical sign can be discerned. And in chronic pain, that's usually the case. Now, as pain management is one of the things hypnotism can be used for, hypnotists have developed an understanding about pain and about how to help. First, pain comes in two forms: chronic and acute. Acute pain is pain that you know had a beginning. You fell down and you hurt your ankle. It will have a middle, where you're dealing with it, and it will have an end. Eventually, the pain will get less and disappear. Now, in my experience, most people can deal fine with acute pain because they know it's temporary. That lessens the amount of emotional distress one feels, and one knows that eventually you'll be able to return to whatever normal means for you. Chronic pain, on the other hand, is pain that doesn't have a beginning, middle, and an end. It is pain that could go on forever. Someone with arthritis or a structural problem, neurological difficulties that cause pain receptors to fire and keep on firing are examples. Now, even if pain could somehow be measured and quantified, and it could be shown that the pain from an acute condition was much worse than the degree of pain from a chronic condition, in my experience, chronic pain is still the most debilitating because you know it's not going to end, and that scares you. Now, we know a lot about chronic pain at my household because my wife of almost 40 years, Lindsay, has had painful orthopedic conditions her entire life. She's had 5 major orthopedic surgeries for severe osteoarthritic pain. These days she does well with medication following double hip replacements, but for most of her adult life she was not a candidate for that surgery. She had to have a huge operation 38 years ago, an experimental one that was hoped would, 20 years in the future, cause enough bone to accumulate in her pelvis to allow the hip replacement surgery. That worked, but there was a whole lot of years before that became available. In my own case, every male in my family has suffered from severe chronic migraine headaches. And even though a headache eventually ends, a chronic migraine sufferer knows they're going to come back again and again until the day you die. Now, if you've never experienced a severe migraine, all the way with pounding head, inability to lie down, projectile vomiting, the whole list, it's probably impossible to understand how bad that pain can be. My father would tell me about sitting alone in a dark room with a pistol in his lap, wondering if that was the only way he could put himself out of pain, and he came close a couple of times. Now, hypnotists have a number of tools we use to help people with pain. First, we might try hypnotic analgesia or hypnotic pain reduction. Typically, we'll do this using some form of distraction. When the pain is felt, the mind has been hypnotized to automatically switch to entertain some other thought or fantasy that takes attention away from the pain and makes its subjective experience less. Or we might do hypnotic anesthesia, trying to completely remove the pain. A common technique is called glove anesthesia, and I've actually demonstrated this in front of a room full of physicians, where you deaden sensation in a hand, usually using an image of an icy glove, and then when the hand is experienced as numb, that numbness is transferred to some other part of the body. This works fine for pain that's temporary. Example would be dental work. But you can't really keep that going long term. Another strategy, one that is far more effective for chronic pain, is to have a person imagine they can detach a part of the body from the rest of the body and put that painful part somewhere else. So you might imaginatively detach in hypnotic trance a part of your spine and put it in your desk drawer to deal with back pain. This also works pretty well and is sometimes the only thing that does. Then there are a handful of other techniques. Regressing a person in their mind to a time before the pain was felt and bringing the recollections of that pain-free time forward into the present. This one hypnotists call timeline techniques. They were developed by Thadford James. While all of these hypnotic techniques work, their usefulness is limited by the fact that the effects last only while the hypnosis does or while the hypnosis is supported through self-hypnosis and regular practice. While hypnotism can help chronic pain, in the last analysis, a chronic pain patient will need either medication or to develop a tolerance for the pain, and I'll have more to say about that in a few minutes. Now, unlike some hypnotic practitioners, I'm a big fan of pain medication, especially after all my years of doing cancer work, which has been one of the areas of focus in my 30-plus year practice. The medical community does have drugs that can help a lot, most of them derivatives of or synthetic versions of opium, called opioids. There's absolutely, in my opinion, nothing wrong with the use of such drugs by those who truly need them. There are also non-opioid pain medications like non-steroidal anti-inflammatory drugs, ibuprofen and so on, but any pain patient will tell you if you ask that they don't work all that well and nowhere near what a lot of doctors seem to believe that they do. Now, for a lot of painful conditions, even opioid medications don't touch the pain that much, except in their strongest form, and there's a problem. Because a few years ago, there was a tremendous overprescription of such medication to people who really didn't need drugs that strong, creating a problem with runaway addictions. The most notorious of these was the drug OxyContin, sold by Purdue Pharma and the Sackler family, formerly known as oxycodone hydrochloride. The drug did work for its intended market. However, people quickly discovered that the drug could be crushed, snorted, or taken in other ways to create a huge high. And an underground market developed for it as a street drug that people were using to foster and maintain an addiction. As a result, there was a clampdown on this and similar prescriptions, even for those in obvious need. Many such patients are now routinely refused such medication, as any physician who prescribes such drugs can face investigation from authorities, hassles, and escalating insurance rate. Pain patients unable to obtain the medication that might help them turned instead to street drugs like heroin with devastating consequences. While I've never personally taken OxyContin, for many years I was taking a much lower power opioid drug called Tramadol. It did help me with age-related arthritis, but mostly I was taking it because for some people, and I am one, this drug can completely resolve migraine headaches, and it did for me. However, the Federal Drug Administration, in the wake of lawsuits about OxyContin, ruled that Tramadol could not be prescribed for any chronic condition, even for long-term patients on stable doses where the drug was working well. I certainly wasn't happy about that because I'd been migraine-free for more than a decade, and I certainly wasn't addicted, as I never needed an increasing dose, which is the hallmark of addiction. But I obey the law. And then a neurologist prescribed other medications for the headaches, and these drugs work, but only sort of. I went from having no migraines for years to having 1 or 2 per month. Not fun. But with physical therapy and self-hypnosis, I cope. Yet these experiences have given me insight into the life of someone who deals with chronic pain, and they get a raw deal. Being in chronic pain is not something that others can see. And so a lot of people don't take the complaint of the pain patient seriously. They look normal, they look fine, but they're not. They can't do things others can do because it hurts too much, and they have to set limits in their lives that other people don't understand. Over many years, I've listened to people in pain complain that no one takes their pain seriously. They get told to suck it up or push through it, and you can do that for some sorts of pain for a while, but no one can do that for severe pain on an ongoing basis, and the lack of sympathy from others is crushing. And the problem is that there is no way to know who's for real and who is not. The result is that everyone is doubted. The one hopeful observation I can make is that hypnotism can help. It's not a magic bullet for relief of chronic pain, but it can definitely make life better for the chronic pain patient. Yeah, you'll have to learn self-hypnosis to keep the benefits going, but that's way better than nothing. To close, I want to leave you with this quote from a physician, a hematologist who posted it anonymously for fear of reprisal from the Federal Drug Administration. The physician wrote, "Chronic pain patients hide it so well, you can't go by how they look on the outside. They have to learn to function with pain. You can't just roll around on the floor all day screaming in agony. Medical personnel in hospitals don't even realize this. A chronic pain patient can function with a pain level that would incapacitate any other person." I absolutely agree. Treat such people with understanding. Hey, thank you for your time and attention today. I'll be back next week with another talk on a different subject, and I'd like to invite you to join me. It does help me if you let others know about my videos, so please like, share, and subscribe. If I can be of help to you, don't hesitate to reach out through email, my website, my Patreon channel. Stay well and stay safe.